And May 22nd through the 26th is EMS Week. If you didn't know, it's an EMS Week full of events and activities recognizing emergency medical providers. And joining me now on the KOM couch with details as to what will take place. We recognize these fine folks, just two of the many, many people in our island to do that kind of work. Our Lieutenant Angel LLAGAS from the Guam Fire Department. LT, half a day.
How you doing, sir? Half a day.
Very good to see you. As well as Ginny Serrano. She is from American Medical Transport. Half a day, Ginny?
Sorry, it's Access.
Oh, Access Medical Transport. There you go. Well, very, very appropriately named because you're providing access to these very services. And I would dare say that access is something that is at the heart of EMS.
Correct.
Yeah. Mm-hmm. Okay, so let's talk about EMS Week. What is the theme of this year, LT?
So the theme for this year is going to be your emergency service begins. Mm-hmm. So that's what it is. So uniquely, it's going to be matching what Guam, because that's where America's Day begins, is in Guam. And it's a week-long set of activities that usually was started when Gerald Ford was president on November 4th, 1974, cited into proclamation to have declared EMS Week to actually recognize EMS responders and stuff like that nationwide.
And the men and women that do this kind of work, I mean, it's, private sector, Guam Fire Department, obviously, our friends over in the federal sector. You guys are responding and helping people out when they are at their in most need.
Correct.
Yeah. So what does it mean to you first, LT? Because I know you've been doing this kind of work a very, very long time. It's one of the ways that you serve our island. So what does it mean to you to be, like on the front lines, literally, of, providing help for people when they need it the most?
So what it means to me is that it's gratifying at the same time, because it's a role of a EMS responder to actually go out there and help the public. So not everybody can be emergency medical services responder. It takes a unique breed of individuals to actually do it, because if you're not used to doing certain things like lifting people, stop the bleeding, doing cardiac arrest or CPR and stuff like that, it takes a unique individual to do those kind of things.
There you go. Well, you have to have the heart, obviously, to do that kind of work. You also have to have the brain, because you're thinking and acting very, very quickly.
That is correct.
All right. Okay. So, Ginny, I'd like to talk to you. What events do we have for this week, and how is the community going to be more aware of the very fine work that you guys do?
I think for the main one, we have for Wednesday on the 24th, it's the Parade of Lights. And then, you can come join us.
Okay, very cool. What are some of the questions you get? Because I know if people see you in uniform or they see you guys, going around helping people, what are some of the questions that, maybe like even kids ask you guys? Did they say like, is your job scary, or what do you do? How did you get into this like line of work? Did they ask that kind of thing?
This will be my first.
Your first EMS week? Okay, cool. So I mean, is it fair to say like this is still like your rookie year?
Yeah, kind of.
Okay, first EMS week. But what does it mean to you? Like, I'll ask you the same question I asked the LT of, what does it mean to you to be able to do this work and to really be there for people?
Oh, I just want to help the community.
Okay, very, very cool. Well, let's, LT, let's walk us through, like, what are some of the daily duties that as emergency medical services professionals, like when you first, come in the morning and everything like that, you got your game face on, you're ready to do the job and everything. Where does your headspace have to be?
So the first thing you have to think about is making sure that your equipment is all properly ready to go and serviceable. So that's the first thing you would do. But prior to that, you're going to get a briefing from the outgoing shift to let you know what's going on and tell you if there are any shortcomings with the equipment or what the supplies you might need. Once you do that, get the briefing, then you go inside your apparatus, medic unit, or the truck itself and actually inspect it to make sure what they briefed you is actually correct, and make sure everything's properly stored and stuff like that, and properly, have supplies for the rest of the day. And once you do that, make sure the vehicles are running operationally. And once you're done, then it's going to be up to the station OIC to decide what's going to happen for that scheduled events for that day.
And this is on a best case scenario if calls aren't immediately coming in, or people said like, oh, I need help. I may have fallen down. I saw a car accident. Like my mom's having shortness of breath or something.
So funny you should mention that, because sometimes during halfway through the briefing, there's actual call from 911.
Yep. And
they call the fire station, and then during the briefing, you have to actually cut it short and just leave the station to go out there and respond.
That duty calls, and you guys answer that call, and we appreciate it. All right, Ginny, maybe you can shine light on what brought you to this line of work, and what was your decision to get involved with EMS work?
Oh, I know when I came here, it was like during COVID, and I just pretty much needed a job, and then I started in the office, and then I worked my way up to drive, an ambulance.
And that's really amazing, if I may say so. First of all, thank you for sharing that, because COVID was a time, I know, when a lot of people I know from personal experience, were studying to be nurses or to be doctors. They kind of called it the great shakedown too, because a lot of people were like, that's not what I signed up for. This is way too intense. I thought this is what I wanted to do. I can't handle it. And that's totally cool, right? It really showed the people that, as the LT said, this isn't a job, it's a calling, right? So you came into the kind of work and you wanted to, jump right in. And what does it mean to you? Like, you're driving around, you're seeing the island, but you're also seeing, again, people when they say, can you please help me because I need assistance?
It means a lot to me. We're private ambulance, and we do kind of do things differently from what GFD does. So we do non-emergency.
And well, that's a very important point to make, because even though it's EMS week, there are a lot of you who work in that capacity to say, like, if you need patients who are non-ambulatory, right? They can't drive themselves to, like, maybe a dialysis appointment or to another kind of medical appointment. Okay. So LT, what is your relationship with people like Ginny's company and everything, that you have this synergy in making sure that everybody can be taken care of?
So for the Guam Fire Department, we do actually emergency transports. Sometimes we do non-emergency transports. If there's a calling and we're busy and stuff like that, and we can't actually transport patients from the hospital to the residents, or residents to the hospital or to their appointments, we call on to Access Medical Transport or any other non-emergency transport units here on Guam to let them know what's going on.
So it is a big network, basically.
Correct.
And we try and have as many different outlets to assist people when they need. Okay, Ginny, what else is going on for the week?
For May 22nd is a proclamation signing at the governor's conference room in Adelup. And then on the 23rd, we're gonna go to the schools and basically something like a career day.
Okay, very nice. So I was asking earlier, what are some of the questions that the kids ask? They're probably going to have like a lot of questions there, and kids, their attention span can be really, really short. But when you guys go out there in uniform, or you say, I'm the one that you call when you need help and everything like that, their eyes just like light up, because they know, and justifiably so, that everybody in your profession, you guys are rock stars, you guys are heroes, and you guys are inspiring them. So maybe on that note, LT, if people are watching this right now and they were like, I've always wanted to do that. The people that we had on the hotspot seem really, really cool. How can people get into this line of work? What kind of training do they have to have, and what should they concentrate on in school?
So for becoming in the fire department, because it's fire emergency services and stuff, it's just not medical. There's actually academies that they actually go through to actually learn the trade and everything else, get them up to speed to where the rest of the firefighters are at. At the same time, they're actually going to the school at Guam Community College that actually hosts emergency medical technician training and stuff like that. And that usually takes anywhere between 3 to 4 months. So that's what they have to do. Once they successfully pass that, they can take the National Registry tests, and once they get certified, when they finish it and they graduate, they can get their local license at public health to actually practice being an EMT.
Okay. And then Ginny, from the private sector and everything, what would you recommend to people who might be watching this and they're like, yeah, that sounds like something that I'd like to do. Like, what's the best way that they can get started, and how can they be an effective staffer?
Okay. So starting off is the same. They have to take the same the classes, and you can also do it online. I've known someone who's done it online, and then the NRMT as well. So the standards are the same, and then you just apply to, if you want to be in Fed Fire or GFD or even a private ambulance company. Okay.
So again, physical fitness is, it really, really helps.
Yes,
also, you probably have to be really good in science, right?
Pretty much, at least learn the basic anatomy, and of course, a little bit of what oxygen does and what kind of medications will do for you and stuff like that.
Yeah, okay. And then I know, Ginny, you shared with us that you actually got into this line of work through COVID. LT, you've been here throughout. You've seen a lot of different things. You've been through medical emergencies during typhoons. You've been through the pandemic and everything. Yeah. How has the profession changed, if at all, in all the time that you've been involved?
So on Guam, traditionally we only had emergency medical technicians. Then we went to the advanced emergency medical technician. Now Guam actually has their first paramedics at the get-go since beginning of this year and stuff like that. So the highest level of care is paramedic, which I'm a paramedic. So prior to that, I was actually an advanced emergency medical technician. So.
All right.
Yep.
Well, Lieutenant Angel Lagas and Ginny Serrano, two of the many people in our island. Again, it's part of a proper network that is making sure that you and I can be safe. So thank you both, and happy EMS week.
You as well.
All right. We congratulate you, and we really, really thank you for everything that you guys do. All right, and please stay tuned. We will be right back with more show right here on the Hotspot right after this.